what happens in sex therapy, plus what to do when you're attracted to someone who is not your partner. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, without further ado, Dr. Leah.
Thanks, Derek. Great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Now let's get right to our first question.
Beautiful. Okay, first question. A woman asks, can an active sex life delay menopause?
Yes, there are many benefits from continued sexual activity, one of them being a delay in menopause. While there have been many studies on the subject, it's not exactly clear what the connection is between sex and menopause, but experts have found that there is an association between the two. Those who are sexually active and engaging in activities such as intercourse, oral sex, and touching were found to go into menopause later, with the average age being 52 years old. Typically, menopause occurs when women are in their mid to late 40s or early 50s. It occurs when the ovaries stop producing estrogen and progesterone and menstrual cycles stop for 12 months. Many women experience hot flashes, fatigue, headaches, or abdominal cramps. Some experience emotional difficulties as well. So take the time to experience pleasure, as your reproductive health could reap the benefits.
Doc, great information on the menopause for women. But I've heard that there is a male menopause. Is that true?
It's not as exact as it is with women. Like, I've never heard of a man experiencing hot flashes or anything to that nature. But male menopause is typically associated with a decrease in testosterone levels. But men certainly go through a time when they're no longer fertile. Clearly, we know men 80s and 90s aren't having children. So they go through the same types of fertility issues, and the quality of sperm also declines.
You know, every time a man hears that a woman is going through menopause, man, we step back. We take it back. You know, I know it's tough. It's difficult for you guys. You're probably not there yet. But what can somebody a woman going through that do to make her sex life better or try to enhance her sex life? There's hope, I hope.
Yes, definitely. The biggest complaint that women going through menopause experience is that lack of lubrication. So having an adequate lubricant, because when women go through menopause, estrogen levels decrease, so they're not adequately lubricated. So that's the number one complaint you typically hear from women. So having a good lubricant, preferably one that's oil-based as opposed to water-based, can be a little bit more helpful.
Great, thank you. A 30-year-old man asks, I've recently noticed a bit of blood in my semen. Will it go away or should I be worried? If it was me, I'd be booking it to the ER. Blood in my semen? Are you kidding me? Really?
Good
Wow.
for you. Men are typically less likely to go to the doctor when they see these things, but it is really, really important. Blood in the semen is called hematospermia, and while it can be alarming, there's usually no reason for concern. And men that are younger than 40, no related symptoms and no risk factors or medical conditions. But over than 40, it could be a concern. Blood in semen often disappears on its own for the younger generation. However, for men 40 and over, chances are much higher that blood in the semen needs evaluation and treatment, as it could come from several different sources. These sources could include the prostate, the urethra, seminal vesicles, or a possible STI. There could also be a number of other medical conditions. So if you're over 40 years old, or you notice that blood, as well as a hot burning sensation, painful ejaculations, fever, discharge, it's really important to see your medical provider right away and seek evaluation and treatment.
Great, thank you. I feel much better. You know, but it does sound bad. So how do you treat it?
Well, it depends on what the problem is. Antibiotics are great if it's an infection. An anti-inflammatory medication may be prescribed for various types of inflammation. If an STD is the culprit, the doctor will treat that condition. But when blood and semen stems from a recent urology procedure, it usually disappears by itself in a matter of weeks. In younger men, blood in the semen that just happens once or twice without any of the additional symptoms that I listed, or they don't have a history of medical conditions, it usually disappears without treatment. But if you aren't sure, or if you're not that young, you might want to go to the doctor. And if he suspects it could be prostate cancer or another form of cancer, they might ask for a prostate biopsy to evaluate that tissue for cancer. The incidence of prostate cancer is low in younger men, but it's even just half of 1%. But the instances occur in men that are older than 45 are much more common. So it's really important to get to the doctor.
We're going to go on to the next question. A man says, I am happy and in love with my wife. Good for you, buddy. But I have feelings of sexual nature for a woman at work. I think it's normal, part of being human. Doc, do you agree?
Well, open relationships are one thing. If all parties know what's going on, that's fine. But I don't condone infidelity. Nonetheless, studies around this topic are interesting. According to research, 70% of women in relationships admit to having crushes on other guys. While they may not act on these little daydreams or fantasies, many women worry about their crushes or think about those crushes while they're masturbating. Unfortunately, I've actually not seen similar studies in men, but it's completely logical that the opposite sex would respond similarly to this phenomenon. So if you're a man wondering why you're attracted to someone other than your wife, it could be a number of things. It could be dissatisfaction in your marriage, lack of physical attraction, or maybe your crush just has some qualities and interests that your wife doesn't possess. The bad news is not all marriages provide all of your needs.
Do you think it's harmful for a man to be thinking and fantasizing about other women? Is it harmful to the relationship?
I think if it's coming in the way of your partner, or if you're fantasizing about the same person over and over while you're intimate with your partner, that could definitely be an issue.
Should you tell your partner?
Well, that all depends. I mean, I can't imagine if it were, some celebrity being like, hey, babe, sorry, I was thinking of Angelina Jolie last night, not you. Like, I don't think that's necessarily the way to go about it. But if you're developing feelings for a crush and someone that you're actually thinking about taking a next step, then that absolutely should be discussed with your partner and probably a marriage therapist as well.
Doc, you mentioned about having fantasies, maybe somebody at work is kind of a common thing. Is that beneficial, or is that going to hurt the relationship?
I definitely think it can hurt the relationship, but it's not abnormal. Actually, the three most common fantasies are having a fantasy about a coworker, having a fantasy about someone famous, or having a fantasy about a previous partner. So I think it's just about containing those fantasies. I can imagine that it would be really insulting to your partner if you were consistently fantasizing about somebody else. So I think you have to evaluate why you're having those fantasies. Is it a quick little thought like, oh, that was fun in the past? Or you're really obsessing and wanting to try it again?
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. You can find out more about sex talk at AskDrLeah.com. Still to come on Sex Talk, what you need to know about care after the loving. Plus, we head out of the studio to get answers to our questions in a new feature called Taking It to the Streets. And then, what using emojis might be saying about you.
If you haven't given thought to your routine after sex, you may want to. Sex Aftercare is an opportunity for you to show your partner you care. Here are some tips.
What you do after sex can be just as important as what you do during sex when it comes to getting closer with your partner. Here are a few ways to strengthen the bond with your partner. Try cuddling to stay close with your partner after sex. Pleasure hormones released during sexual activity can also be released when cuddling. One study even revealed that couples who cuddled more were happier in their relationships. Another way to bond is to talk. Feelings after sex can range from relaxation to depression and irritability. Check in with yourself, then communicate how you're feeling with your partner to strengthen your emotional connection. Also, pay close attention to your after-sex hygiene routine. Cleaning and taking showers can prevent infections. Consider sharing these routines with your partner for more intimacy. Lastly, spend time with each other in non-sexual ways. This can include taking a nap or watching television. Being together without being intimate can bring you closer together.
That's right. The things you do before, during, and after sex can help shape your relationship. Coming up, Could using emojis be the key to a better love life? Plus, what to do when your ED meds stop working.
We are on the streets. Typically, you guys are asking me questions, but now we are turning the tables and I'm asking you all questions. So now I have to know, you guys have been together for a while. What is your worst, sexy time fail?
We haven't had any.
There we go.
Have you ever been in public and kissed somebody to make somebody else jealous?
Oh, I'm sure. Absolutely. 100%.
Wow, okay.
Really got to stick to them.
No, that's not my thing. No, I'm not a big PDA'er. No, but I haven't done that before.
Okay. No need to, right?
No need.
Kind of
Have you
noise.
ever made out or done something even worse just to make somebody jealous?
Oh my God, I've been married 20 years. So I would say, honestly, no. Not that I can remember off the top of my head. I don't think, not just to make someone jealous. I don't have time for games.
What gets you in the mood?
Besides martinis?
There we go.
Okay.
I think more of just tactile, like caressing, massaging, putting gentle pressure around the body to get your whole body up and aroused, rather than just going for the kill all at once.
A little bit of alcohol, I'm not gonna lie. Probably some good sexy music, so.
Tequila.
I have to admit that has been a theme on the streets here. What is the one thing that gets you each in the mood?
Music.
Oh,
Some
okay.
music.
What kind of music?
Shake your booty too.
Oh, what? It's a cable.
Yeah. All right, what about
PBS.
you?
Any type of subtle touching definitely gets you going in the right spots.
Welcome back to Sex Talk. Let's take some more questions.
Here we go. A woman asks, can you still have sex if you have a yeast infection?
Yeast infections can be uncomfortable and sometimes painful. Naturally, from the symptoms alone, it's likely that you're going to want to refrain from sex until everything's cleared up. From a medical standpoint, it's certainly possible to have sex with a yeast infection, although most doctors would suggest waiting until the infection is gone to avoid prolonging symptoms or causing symptoms to return, or even increasing your partner's risk of developing a yeast infection. Yeah, that's right. Sexual partners can transmit yeast infections. However, the likelihood of transmission is small. Although it is larger in uncircumcised men, keep in mind it is not a sexually transmitted infection. If you suspect you have a yeast infection, contact your healthcare provider as soon as you feel the symptoms. The treatment is fast acting, and then you don't have to worry about it.
Doc, what exactly is a yeast infection? How does it happen? How do you know if you have it? And, what should you do?
Well, actually, it's a valid question because the symptoms of a yeast infection can manifest similar to the symptoms of a sexually transmitted infection, which is why it's always best to go to the doctor if there's any abnormal itching, burning, or discharge.
Is there any way we can test at home? Because, some people just don't like going to the doctor, me included.
Well, and especially if people are worried about sexually transmitted infections and they're too embarrassed to go see the doctor, there are at-home sexually transmitted disease or infection tests that detect the presence of specific sexually transmitted infections. Each infection requires a different laboratory test, so it's important for people to make sure that the at-home testing kit that they're using is designed to detect the appropriate infection. Some infection tests look for the genetic material or DNA of the bacteria, virus, or parasite that may be causing the problem. Other tests can detect the viral proteins or antigens or antibodies that are produced in the body that may cause a response to a sexually transmitted infection.
You're smart. You got a lot of information. It's amazing. How does a home test work? Is it kind of what do you do? How does that work?
It depends on the test. At-home STD tests are mailed to your home quite often, or you can purchase them and do them in your home. You also have the option to bring the results to a local lab, or the local lab can send that sample to a certified lab for testing.
Well, let's go on to the next question, Doc. A woman says, it seems like my vagina is swollen and I can't figure out why. What caused this and how can I get it back to normal?
Well, if you've noticed your vagina is swollen, there could be a number of explanations as to why. Sex, an allergic reaction, yeast infection, bacterial vaginosis, and even pregnancy can all contribute to a swollen vulva. If you suspect it's an allergic reaction, limit the usage of products or clothing garments that could potentially cause the irritation. An over-the-counter cream, like a cortisone cream, could help reduce some of the symptoms. If you're noticing a swollen vulva after sex, this isn't uncommon and is actually deemed normal. Sexual arousal causes increased blood flow to the area, causing it to swell and become puffy. Try putting a cold press on the area to help reduce swelling. A swollen vulva is also a symptom of vaginitis, which is an inflammation of the vagina. Vaginitis often results from bacterial, yeast, or viral infection that can cause an imbalance in the overall vaginal bacteria. Certain skin disorders or low levels of estrogen can also cause the condition to occur.
So when a man has blood rushing down there, it's usually a sign of excitement. Is a swollen vulva can also be a sign of excitement?
Yes, but it typically goes away after intercourse or after the excitement has dissipated.
Okay, so what should they do? Let's say not that part. What should they do when they are having those symptoms? Imagine you mentioned go see the doctor or some creams. Anything else?
Yeah, she should see a doctor if the vulva is swollen for more than just a few days. Like I said, they may prescribe a topical steroid to reduce the swelling or any other cleansers to treat any secondary infections. Don't go anywhere. We'll be right back with more sex talk.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Do you text a lot or use emojis? Research is breaking down how texting styles affect relationships.
From mailing a letter to sending a message, the ways we communicate continue to evolve. And when it comes to talking online or through text, there's a lot to consider. When to respond, how to respond, emoji or no emoji. Several studies offer some answers. One study revealed that people who used emojis were more likely to have a second date and more frequent sexual activity. It's believed that using emojis allowed people to illustrate their emotions, similar to a face-to-face interaction. Although the study also revealed a general sentiment that communicating clearly via text is difficult for most people. Other studies suggest that similar texting styles are key for relationship satisfaction. This could mean that a person who likes to text a lot may prefer someone who also likes to text a lot. And the type of messaging can be important too. When it comes to sexting, one study found that people who sexted more were more likely to engage in cheating and other conflicts. Overall, research shows that sexters were not as happy or unhappy as those who didn't sext. Messaging and texting are only one aspect of communication. Understanding how you communicate and its impact can lead to more effective communication and a more successful relationship.
Today, texting and messaging are the norm, but nothing replaces that face-to-face communication. Let's take some more questions.
A viewer asks, we are considering counseling and other forms of therapy. What actually happens during sex therapy, Doc?
Like any type of therapy, sex therapy takes a lot of work, but it can be a rewarding process. If you're unfamiliar or unsure about what to expect, a sex therapist is not much different from a traditional therapist. They have training to counsel patients on anxiety, depression, and other mental issues. The key difference is that sex therapists are expertly trained and certified through the American Association of Sexuality Educators, Counselors, and Therapists. They provide a safe space for clients to help them navigate what sex and sexuality means for their clients. Sex therapists can also help individuals achieve their goals around intimacy. Oftentimes, couples begin sex therapy unsure of their goals, but it's a great resource to better understand one another, how the human body works, expand ideas on what sex can be, and help those navigate through pelvic pain. The word therapy can be daunting for some, but the reality is it's a safe space to explore sex and sexuality with the goal of reaching a sex-positive and fulfilling place for yourself and your partners.
Is sex therapy the same as couples therapy?
It can be very different. I mean, a lot of times they go hand in hand, right? So couples might have an issue and that bleeds into their sex life, or maybe sex is the main problem and that's gonna cause a problem in their relationship. So typically couples therapy, you're starting with the problem being in the relationship, whereas sex therapy, most other things might be going decently well, but you're having sexual issues.
Actually, you'd probably be able to get a man to go to a sex therapist before going to a regular therapist if you think it's going to help the sex life. I don't know. I'm just saying my point of view.
Maybe so. I don't know. I mean, men typically are more reluctant to therapy than women, so whatever gets them there, it improves their sex life.
Oh, beautiful. Okay. Doc, we have another question. I want to know, this is for a friend of mine, by the way. I have a lot of friends, as you can tell. I want to know, are there any other meds besides PDE5 for ED? Mine stopped working.
Well, I would start by looking at why PDE5 inhibitors aren't working. Most of the time, it's because of an inadequate dosage. Too much or too little over time can really impact the effectiveness of the medication. It's also possible that the root cause of your ED is getting worse. Oftentimes, someone has an underlying condition like atherosclerosis or diabetes. The condition can worsen and ultimately affect the outcome of the inhibitors. While there isn't much research comparing different inhibitors, most patients will try one and try a different one as the first approach. Although when it comes to medication, that's a discussion that you need to have with your doctor. I will say treating ED can require more than just a pill. The psychosexual therapy can also help even when someone has a history of failed inhibitors. Therapists can help you work to address the different aspects and different ways to approach your sexual experiences with the medication, including the readiness for sex, all of which can have an effect on the potency of the medication. And it's not always one or the other. Even when it comes to medicine, sometimes it's all about finding what works best together. Other alternative treatments may include using a vacuum constrictor device, which can work by causing a negative pressure, producing an erection that can last up to 30 minutes. There's also something that works by injection, and it relaxes certain muscles, causing an erection. So if your ED medication isn't working, don't give up. There are a lot of other options to try.
How about that famous blue pill or the yellow pill, the Viagra and the Cialis? Are those cures or maybe temporary?
Well, that's
solutions?
going to be part of your PDE5 inhibitors. Okay. So that's a lot all into the same family, and those are usually your first line of defense. So if somebody's got ED, you're not going to say, let's go into surgery. You want to start with a pill. Typically that works, but sometimes even just changing a pill. Well, not all pills work for all of us. It's just like any of the other ailments. There's many different types of antihypertensive medications. Some work better for some people, others for another.
So it's probably fun to experiment with all the different pills.
Exactly. Assuming you got the advice from your doctor.
Of course.
Remember? Yeah. Prescription drugs are illegal unless they're prescribed to you. So, yes, it may be fun to try with your doctor's supervision.
But you said to you like you're talking to me. I'm good. I'm cool. It was my friend who was asking. Anyway.
Oh, yeah. Okay. Your friend.
Don't forget. My partner, here's another question, Doc. My partner says he thinks he has performance anxiety. Is there anything he or I can do to make it better?
No doubt this could cause anxiety and frustration for both individuals in the relationship, but try to reach a solution together, and that may actually draw you guys closer as a couple and automatically improve your sexual relationship. Remember that being sexual means more than just sex. Activities like sensual massages, baths, or even taking turns masturbating may distract you enough to forget about all that performance anxiety. It's important to stay open-minded and patient when it comes to arousal. It's nothing to be ashamed of, and sometimes it can be something as simple as like meditation, guided imagery, or even just changing your lifestyle habits. Exercising more can enhance your performance. And if all this doesn't work, don't be discouraged or embarrassed to seek therapy. Like we talked about earlier, sex therapy is a great solution for creating a safe space and working through your sex life and sexuality.
I know that probably for women it's a lot more difficult to masturbate than men, so how do you get your partner, the female, to relax? Like you mentioned earlier, you said mutual masturbation, that would help a lot. What do you do to break her, or sometimes him, out of it, or how do you help that?
I would say the biggest thing to do is have them encourage masturbating on their own first, or get intimate in other ways. Learn how to be intimate without sexual intercourse. Give your partner a sensual massage, take a bath together. Just take turns pleasing each other so you don't always feel so pressured to perform sexually. Distract yourself, put on some sexy music, think about something that turns you on. Just take your mind off of sexual performance and remove any worries that may stop you from getting excited.
Good.
Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time where we answer the questions you always wanted to ask on Sex Talk.